Welcome to this special show on NewsX. We are today going to be in conversation with the alumni and, of course, several in administration at the prestigious IIT Kanpur. Yes, Indian Institute of Technology Kanpur is always known for producing some of the bright young minds that our country is proud of. But now those bright young minds are actually making their institute proud as well. The current COVID pandemic has, of course, thrown the country into complete limbo. It's thrown the entire world into a state of lockdown, which is, of course, having devastating economic impact and also a human impact as well, with a tremendous loss of lives. This, of course, calls for a time for emotional well being, but also for a time for innovation as well. Yes, the Prime Minister of India has also spoken about Atmanirbhar Bharat and go vocal for local. So it's no better time than to have a conversation on innovation and how we must encourage the young minds of our country, of the sons of the soil of India, to make our country proud. What should they do to create businesses which will be profitable, which will, of course, help India become a superpower, but also generate employment for those who are facing these tough times. We're going to be having a special panel who's in fact joining us now, in fact, live on our screens. Let's quickly introduce all of them to you. A power-packed panel in this special IIT Kanpur Innovator Special. We have with us the Director of IIT Kanpur joining us, Dr. Abhay Karandikar. Welcome, sir. Thank you very much for joining us. Dr. S. Ganesh is also live with us, Deputy Director of IIT Kanpur. We also have Dr. Amitabh Bandyopadhyay, Professor in charge, Innovation and Incubation, who's joining us live. And we have 3-star alumni of the institute who are also doing the country proud and their own institute proud with the innovations they've come up with as well. We have Dr. Sandeep Patil, founder director of eSpin Nanotech, joining us live. Dr. Madhu Vasipalli, founder of Kupro Health Technology, joining us live. And Mr. Harshit Rathore also joins us. He's co-founder of Noka Robotics. Thank you all very much for speaking with NewsX today and joining us on this special panel. Let me begin with the director of the institute first. So, Dr. Abhay, if I can come to you first. Dr. Karandikar, do you believe at this time, at this very crucial, unprecedented time, it's intrinsic, it's important to encourage innovation, to encourage thinking out of the box? And is that what you're also attempting to do at the IIT Kanpur?
Absolutely. I think it is absolutely important to encourage innovations. And we actually, IIT Kanpur has a very strong ecosystem of innovations and R&D in the institute. And we have a very strong incubator program, which is being led by Professor Amitabh Bandyopadhyay, and he will talk more about it. But I think more importantly, what we really did during the COVID-19 pandemic, I must say that our faculty and our researchers and our incubating companies and our incubator really rose to the occasions and fast-tracked many of our innovations and R&D from the lab scale to prototype and finally up to the product development. And here with me, you are showcasing today 3 of our incubating companies, which within a short period of these 2 months really took lab scale development to a very commercially viable product that we could deploy to handle the COVID-19 pandemic. So it is indeed the need of the hour, and not only it is essential to innovate and translate R&D into commercially deployable products, but as our Honorable Prime Minister has said, it is also important that we become independent of any foreign imports, etc., so that during emergency situations we are able to address the national needs with our indigenously developed technology. And I'm very proud that IIT Kanpur has responded to that as other institutions.
Absolutely. So, Dr. Ganesh, why don't you come in here before I also bring in Dr. Bandyopadhyay on, of course, the projects which are currently on and, of course, have been started in the last few months. But Dr. Ganesh, clearly IIT Kanpur responding to the Prime Minister's call, IIT Kanpur encouraging innovation. How important is that? How did you bring that change about? How did you encourage this innovation in the first place at your institute? And do you also believe that when we talk about go vocal for local, it's about local institutes, it's about our local talent, and it's about, at the end of the day, Atmanirbhar Bharat, where if our local talent thrives, so will our country.
That's right. So, one of the main thing is that the challenge is really something that is liked by the students as well as the faculty, be it in projects that involve the academic, interest, or that have the application like what will be displayed in the next few, minutes. Our innovators will share with you what are the products and how they, brought this into reality. So this COVID pandemic really brought us a challenge, and that's the challenge that really people took upon, and then came up with ways to overcome and make a product that can be launched in the market. So that's something that is really good. And what is important, what we also realized is that these challenges, we realize something. Normally, we used to think that Kanpur or any such somewhat city which is not one of the metros, we often find that the connectivity, other issues are there. But when the entire the country was in lockdown, we have to resort to other modes of communication, and it was a level playing field for all of us, and we have to really connect with our well-wishers in terms of getting their ideas or using their connect to get the project going. In that way, really, we felt that this kind of a being in a kind of a mindset that we are not in one of the metros, it would be difficult to compete with some of these very time project that has to be done within a week or so. That we realized that is not at all an issue. I mean, that is where something that really gave us a positive input, and we are sure that is going to really help us in the long run. And of course, the important thing is that when you come up with any product, we need to realize that whatever we are making is something that you should make with what is available. And
right.
that has been the main motto behind the product that we are going to see here. In most of these cases, the innovators, the faculty, the students, and in our startup companies, they really looked at products that are locally available. Therefore, there are no issues with regard to the supply side. I mean, that is another important thing that we need to consider when we plan any new product or innovation as such.
Okay, fair enough. Yeah. Let's take that then to Dr. Amitabh Bandyopadhyay, who of course is the professor in charge at IIT Kanpur, in charge of innovation and in charge of course, incubation and these projects. So Dr. Bandyopadhyay, tell us about how you actually inspired your students and of course the staff, the professors, and your alumni to come up with these projects, to be innovative, to spur this incubation, and what currently are the projects that you're working on, some which are already complete and some which are in the pipeline. You'll have to unmute yourself. Yeah.
Yes. As Professor Ganesh mentioned, that I didn't have to do much to inspire. The COVID crisis itself was the inspiration for all, that they need to rise up to the challenge. What I was able to do is to gather enough support system for all these different innovations. So I'll tell you how it happened. So on 16th of March, I still remember all the dates vividly. 16th of March, I sent an SOS to all the incubated companies using a document generated by mygov.in, that these are some of the products government of India will desperately need if COVID crisis peaks in the country. And, I got responses. Someone said we will be making face masks. Someone said we will be making face shields. And you are seeing here today the disinfection chamber. The most stunning one was, of course, the company Noka Robotics. They said that we will be making ventilators. Now you need to understand that this company makes solar panels that cleans, robots that clean solar panels. So they are very good at robotics, but a ventilator is a very different ballgame. So what we did is, because we have a very vibrant medtech innovation ecosystem, I have many doctors in my network. So I made them sit with the doctors and let them understand what will be the clinical requirement for a ventilator. And we are talking about invasive ventilator, which is a very different ballgame. So they understood that part. Then we have alumni who are global R&D heads of major medtech companies like Stryker Corporation, Pentax Medical, etc. So then they consulted with those alumni and understood the project from the engineering perspective. And then I went back to my board where there are two prominent board members who understand the business development really well. Dr. Saurabh Srivastava, who was the founder of NASCOM and IAN, and Srikanth Shastri, who understands Indian startup ecosystem perhaps better than most of us.
Yes.
So they quickly gathered a team of mentors. Like this included founder of HCL, major MDs and CEOs of other medical devices companies like Zimmer and Baxter, etc. Every day for 2 hours we used to meet and make sure that the company is moving in the right direction. You can imagine that when the entire world was in lockdown, at that time you were making a device that has 200 plus components. So the supply chain movement had to be precise. And the common thread that is there between all these innovations is a side of Indians that has perhaps remained understated all along, is fantastic ability to collaborate and rise to the occasion. I can tell you, Uday, that every government offices we approached, whether it is Pune City Administration, Maharashtra State Government, Central Government, every help we asked, it was extended without a question.
Okay.
There is a major multinational company, I am still not stating the name. One of their employees is a friend of the Noka team, and he was a key player in the development. When Noka team, the guy had to join back the company, and the company bosses got to know that he was involved in this project. He said, you don't need it in the company, you go back to your friends and develop it. This is, I simply wish that this spirit lasts in India. Then we will be Atmanirbhar no matter what.
Absolutely.
And the same thing you will see when we came up, in the middle of the lockdown, when you were trying to make lakhs of face masks that Sandeep Patil will talk to you about, to get a space that will be clean enough for such a sophisticated operation is not easy. So I have to give a lot of credit to all my colleagues and the senior administration, Professor Karandikar, Professor Ganesh, to make it happen within 2 weeks.
So it was a team effort. It was, and it's great that you've given us the background story about what all went behind, and surely this needs to be done. This needs to be replicated in other institutes and other parts of the country as well, if we are to create a complete, robust structure of Atmanirbhar Bharat. But I'll come back to you and we'll explore some of those issues in just a bit. But let's bring in then your star alumni, the incubators, the innovators of IIT Kanpur, who hopefully will inspire many others who will watch you today and hear you today also take such a step. So let me go across to Dr. Sandeep Patil first, founder director of eSpin Nanotech. Welcome. And Dr. Patil, tell us a bit about what eSpin Nanotech is, what the innovation that you've come up with is, and what actually led to you taking this step. You'll have to unmute yourself, Dr. Patil. Yeah.
Thank you, Uday. I must tell you one thing here. In IIT Kanpur, we don't have a box to constrain our visions. So we always think out, there is no box. This is what our philosophy. So the work we started basically for this nanofiber based N99 and N95 mask that we started 2 years back basically. Our vision is, to protect the human beings from the virus and bacteria. Not only antiviral and antibacterial, but it should deactivate virus and bacteria. So the company specifically work in the domain of nanofiber technology, where we are in a development of new membrane technology only for virus and bacterial infection to control it. Along with this, when this started and working on it, there was a big challenges in front of us, how to scale it up. So immediately, we Professor Bandyopadhyay said, and I must thank you, Director Professor Abhay Karindikar and our Deputy Director Professor Dinesh. When I approached to the incubator and I told them that this is what we needed and it should be immediately as soon as possible. So we started 2 months back, okay, and all the infrastructure, everything for the scale up the pilots is, as well as we started manufacturing of the masks, not only few masks, but we started around 25,000 per day. That was our target, and we could able to achieve that target with all this facility. I must tell you here, it is the first of its kind initiative by IIT Kanpur. It is not the the regular. No IIT has done this before. That any kind of such facility to scale up the pilots even has been provided by the IIT Kanpur, to go further. And today we started within a span of 1 month. We could able to assemble each and everything. There was no a single hurdle. Okay, it was so smooth that we could not able to constrain ourselves that this is the problem that we are facing it, but we never face any of the problem in the lockdown situation even. When we started the work, there was a lockdown first, when Prime Minister Modi announced that 23rd of May, that complete lockdown. Even that time, our team of people, many professors from IIT Kanpur, many students from IIT Kanpur, we started working on these particular problems, and we never feel that this is a lockdown period and we have a lot of constraints. So all the doors will open, of course, provided safety and security, everything. It is not that we working just like that, but no. So here is that is how within a span of 2 months we could not able to achieve in 2 years, we have achieved in 1 month. Okay, so that is how our progress is, and that is how our platform is. So our aim is to provide a low-cost solutions to the common people, to the Indian community, to the Indian society, where we can sell this mask with the help of IIT Kanpur at a minimum cost. How we can protect them, how we can use. Even this project is funded by DST, Department of Science and Technology, not only to antiviral and antibacterial, but to provide a reusable mask with the antivirus.
It's a public service project, Kelly, because people will be using masks and requiring masks for the foreseeable future, and so that people can have it at affordable rates is your goal.
Absolutely.
Okay,
Absolutely.
I'll come back to you. Let me bring in the others. Dr. Madhu is also with us. Dr. Madhu Vasipalli, founder of Kupro Health Tech. Dr. Madhu, please go ahead now. Just tell us a bit more about what you've come up with, what Kupro Health Tech is all about, and how you actually thought of this, what support you got from the institute, and how this can actually be an inspiration to others.
Well, hello everybody, and good evening there. Well, perhaps I'm the person who's actually not from IIT Kanpur, but I'm actually a pediatric dentist from Hyderabad. And when we did come up with this idea about a very intelligent disinfection chamber, and we pitched the ideas, Professor Amitabh Bandyopadhyay was there, and our mentor from IIT Kanpur, Dr. Nikhil Agarwal, they immediately picked it up, and then they gave us all the support that was needed. And it was a journey which started with a simple idea when we actually started seeing people, and we understood that that this is a disease which is going to be with us, and it's not just going to go away anytime soon. And all that we had to do was to ensure that the people, whenever they would get exposed to the situations that will be coming up in the future, we would have to anticipate the kind of problems, and we have to be armed and be ready and not to put our people in harm's way. So it was during this time that you would have noticed all kinds of contraptions and things that come up all around, which did not actually suit. And then when we came back to the idea, to the drawing board, and reached out to IIT Kanpur, I think it was a fantastic journey with Professor Amitabh Bandyopadhyay gave us, along with our mentor, Dr. Nikhil. We immediately came up with a very intelligent disinfectant and a sanitation chamber. So this chamber basically is IoT enabled, And all the chambers or the tunnels that you would have seen in the news that just propped up these monstrosities actually had people that were being sprayed with a chemical that was very harmful to the skin and the other organs. So we did come up with some amount of research and said we should actually screen them. And in the process, what we actually came up with was a solution that would detect a person even before he would get into an area where he would expose the others. So in doing so, what we did, we came up with a concept and a solution called SaniWalk. So SaniWalk is a disinfectant chamber, which is enabled with IoT. It also has facial recognition. It also detects the temperature. And once the person is detected as free of any temperature or any other issues, the doors automatically open. Vis-a-vis, if the person is detected with temperature, the doors wouldn't open and would send off an alarm or set off an alarm for the sentry at the gate. And as and then the process started building up, we started looking at collaborating it with an cloud-based an application. So if you're standing at a place where, like a hospital, airports, or in malls that you would be opening up, as we just saw in the news that, lockdown 2.0 is going to open up, and you're going to be faced with a lot of plethora of issues there. These solutions were very important. And when we did go to the market with this kind of a solution, it was fantastic that we reached out to the best hospital in the world in terms of gastroenterology, which is the AIG hospitals. The response was phenomenal. And the solutions that we came across and we had to solve the issues were something related to multiple other issues. And we started getting into becoming a solution thing rather than just a product-based company. And we ended up talking to the Airports Authority of India. We are now talking about sanitizing the luggage, sanitizing the cargo. We are now talking about with ITC for hospitality sector. We're talking about robots in terms of sanitizing rooms once the guests check out. So all these solutions kept cropping up, and then now we are, we are now challenged, and we are putting our brains to work with my colleagues, who's a retired, who's just come out of the Navy, Mr. Suchin Jain, who is a commander from the Navy, and Mr. Tamiraju. These are the two teammates who came with a lot of support.
Just a quick point here. Also, I think you can clarify on how safe disinfectant chambers also are, because there's a global debate on that. On these tunnels and of course these disinfectant chambers as such. So perhaps you can weigh in on that as well.
Yes. So I think the first challenge that set off was the news that actually showed a lot of these migrant laborers who were sprayed with the sodium hypochlorite bleach, and then that set off a signal. And we actually came up with a solution with a chemical which is approved by our NABL laboratory. And as we are talking, we've applied to the CCMBs and the ICMR for its approval, which is basically biodegradable zinc, which is biosynthesized colloidal silver, along with biosynthesized zinc, which is coated in a polymer and which is being tested at the hospitals. As we are talking, we are seeing people going through, and this is completely safe for the humans. It's safe for the skin, the inhalation, the cornea. All the tests are going on as we are talking, and we have all the approvals from the NABL accredited laboratories. We're due for the permissions from CCMB and all, which we have applied for. So this is where it is going, but bleach, of course, has been dangerous, and so that is not being used. Most of the countries across the world, they're using hydrogen peroxide or superoxole. The people talk about ozones and stuff of all kinds. So our solution is a triple enabled one. We're talking about far UVC. We're talking about a solution that can suit every need, not just one particular chemical, ideas of that sort.
Let me now rope in Harshit Rathod at this point, co-founder of Noka Robotics. Firstly, Harshit, thanks for staying with us and your patience. Let me bring you in here on a bit, if you can tell our viewers about what Noka Robotics does, what the innovation that you've come up with is, how the idea came about, how you worked in partnership with the institute, and how your story can be an inspiration to, of course, some of the students studying at the IIT in Kanpur, but of course the rest of the young and youth across the country.
Right. So Nova Robotics was started in 2017 by me and my co-founder Nikhil, and we were basically into solar panel cleaning robots, as Professor Bandyopadhyay said. So we started that, and it was going good. And we recently, last year, we moved to Pune into a new office and a factory, and we were having successful trials with a lot of clients with our robots. But then the lockdown came in, and we had to shut down a lot of operations because of that. So after that, as Professor said, there was a message by Government of India that there will be some products that will be in shortage, and if these can be developed indigenously. So we had this idea of the ventilator, wherein, because this was going to be a very supply limited design, a lot of logistics and those kind of things were issues at that time. So we started with something that was locally available. So we made a low cost design, and we presented it to the committee of doctors that was put up by Dr. Bandyopadhyay. Then after that, we got a feedback from them that a ventilator is a critical care device. So it's not something that has to be very simple, because there are a lot of parameters which has to be in the hands of a doctor to successfully control all the parameters of the patient. So what we did was, then we changed the design a little bit, and by that time we also had a specification laid out by the Government of India. Now what we have with us is a very high-end ventilator. It's the ICU ventilator, and in the 2 months, a task force was put up by Dr. Bandyopadhyay, and the whole SIIC Incubation Center team was there with us to work with us, and we were completely working on the product side. Rest everything was taken care externally. Then I think it took 40 days for us to came up with the ultimate prototype. Then we had put that into testing into a lot of hospitals. We did a lot of endurance testing, performance testing. At this point of time, we have successfully done patient trials in major government and private hospitals. And today, what we have is a very good product that is suitable for the ICU. It's a high-end product, and at the same time, it is much more cost-effective when you compare it to the imported ones.
And is it being used by hospitals already, Harshit?
Yes. So right now, we have given demo pieces to the hospitals, and we are still receiving the feedback, and we will be starting the commercial sales from the next month.
Fantastic. And is it also going to be priced effectively because it's all indigenously manufactured?
Of course.
Okay, fantastic. So, this is a story of course, again, of how, from scratch, literally, a robotics company and an innovator and an entrepreneur, of course, has created a ventilator because the need of the country was for ventilators right now, given the COVID situation. Fantastic. Before I open it up to some larger issues, Dr. Bandyopadhyay, quickly just coming back across to you, we've profiled 3 individuals, 3 companies, 3 successful innovations on our show today. I'm sure there are many others. If you can just give us 1 or 2 examples, of some of the other projects which are in the pipelines, which perhaps may be ready in say a month, and then we'll do another show like this one, or some of the other, projects that already are in the market and have been come up with your students all up.
Yeah. So, ours is a very product-heavy incubator. One of my colleagues have developed a very good oxygen concentrator, a low-cost oxygen concentrator. As we speak, we are negotiating the commercialization process of that. One of my colleagues is developing a vaccine for COVID-19, but I must tell you that it is a very long shot. There is no guarantee that the vaccine will be made, but he has credentials of doing this kind of work successfully earlier. So we are hopeful. Apart from that, there are many smaller things that have been developed, like face shields. Oh, by the way, I must talk about our PPE. So we need to dial back to the end of March, when there was no supply of PPE in the country and everybody was suffering. Many of my faculty colleagues came together, and they came up with this brilliant idea that the main problem is the non-woven fabric. So instead, we should not be limited by the fabric, but we should ensure protection. So they came up with a polyethylene-based PPE, which was open sourced. So, and I am happy to tell you that in Agra Police and several other organizations actually use those PPEs because those were extremely low cost, easy to manufacture, and open sourced, so anybody could make it. So yeah, I'm very, very proud of my colleagues and my students and my incubated companies.
Fantastic. And is that the, that's the true spirit of innovation, isn't it, Professor Karandikar? That, you've got to adapt. You've got to constantly adapt, constantly reinvent, constantly innovate, to what the situation demands, to what the problems facing your country is, to, of course, do public service as well, like some of these companies are, by saving people's lives, and helping people against the current situation, but also, leading to economic growth. Because if their company's, economic success happens, their employees' success happens, and the country's growth also is you contribute to the country's growth as well and the country's GDP eventually.
Absolutely. And I think, as Professor Bandyopadhyay mentioned, that the key thing that made us successful, and you heard, these three stories, where, for example, what is the difference in COVID-19 and why, we were not able to do earlier? The key thing here was a very concentrated, collaborative efforts which was launched pan-India wide with the team, which, for example, in the case of ventilator, as Professor Amitabh Bandyopadhyay said, the doctors, the mentors who were seasoned industry professionals, and then a lot of other people came forward to fund the projects, and then there was a market, there was a need. So all these factors, when they come together, that we have a team of bright innovators, which is like our Harshit and their team is there. We have a team of seasoned professional mentors, who have experience of driving such projects. And then we have the team of end users who really specify the projects, keep improving the specifications, and therefore, the innovators go back to the drawing board and then keep improving the product. So when all these elements fall in place, then, an innovation can really be brought to the market and can become a successful product. And I would just take up what Professor Bandyopadhyay said, that we need to keep this spirit beyond COVID-19. And it is not just related to the products which are required for COVID-19, but our incubator has been doing a lot of work, for example, in agri-tech sectors, in other sectors which are really critically needed. I mean, when we say Atmanirbhar Bharat, it is not just for the healthcare. We also need for agriculture sectors is also one of the sectors. And we really need to keep the spirit alive, that with a collaborative, concentrated efforts, where the funding is also there, where the market is also there, where the end users are also there, and the government is also supportive, I'm sure, we will be able to develop, indigenous products and companies.
So clearly, Dr. Ganesh, it's not just, this current situation which has spurred your incubator to suddenly get active, but you've been doing this for a long time. You've been festering this innovative culture and nurturing it at IIT Kanpur. And I'm sure it must be a matter of great pride for you and for the other professors of the institute to see these innovations, blossom in this manner that they are, because this is really what should be taught in classrooms, right? To constantly innovate, and you're clearly seeing what you're teaching translate into action in real life.
Absolutely. So, the incubation activity at IIT Kanpur started sometime in 2004 onwards. And we have made tremendous progress in the last 10 years or so. And we have a large number of companies that are being incubated now. Many have successfully graduated. They are very good stories. But I believe that this COVID condition, although it is not good for the country as such, but this has really given us confidence that even if there are challenges, if we take up challenging problems and if we can put together a good team, we should be able to deliver. That is something that is really, really good in terms of how we can come up with ideas that we can translate into products and so on. And also the kind of, the success that we have seen in the last 1 month, that we could visualize a a product and you're able to test and be able to manufacture and commercialize is something is going to really boost our confidence. And many of the students who would listen to this story would come forward and take up this kind of a challenging projects to start companies or translate ideas into product. That is going to be real inspiration. I'm sure that this kind of activity is going to grow exponentially in the institutes.
Harshit, do you believe it's a great time for Indian innovators, with this push for go vocal for local, with the Prime Minister's call for Atmanirbhar Bharat? Will that help Indian businessmen, Indian entrepreneurs, Indian innovations like yours, like the others on the panel today? We constantly talk of this brain drain, with people who study, of course, in India, who go abroad and work there. Of course, we're proud of them as well, but that's a brain drain that happens. Do you believe that will reverse the trend? Looking at the current global situation, perhaps will reverse, and maybe we should take advantage of this situation, and India will grow as well because of it.
Yeah. So what has happened in this situation is it has taught us that the mindset which we had post independence. I heard it from one of our mentors that we generally feel that we are not good enough when we compare us to the West. So the thing which we have built in the last 90 days, it proves that if we have the will, it can be done, and the product right now very well competes with the highest end machines that are available in the market. So definitely these kind of projects and innovations will be inspiration for the engineering people. And I really hope that the brain drain thing which is there, once companies like us and all these companies start building up, we will definitely have people who will want to stay in the country and help these companies out.
Absolutely. And Dr. Madhu, if someone innovates, that helps many other people. Of course, public service is also being done through some of your innovations that are in the healthcare space per se. But as Dr. Karandikar there was saying, that it's not just the healthcare space where this innovation is needed. It's also needed in agriculture. It's also needed in in other economic sectors. And if people innovate, if people come up with successful ventures like the ones we're talking about, that helps our employment as well, because then you employ others. Then you spur growth, and that also helps our country's GDP at the end of the day.
Well, society is a culmination of everyone together. So I just take a few minutes to say that, when we started, we actually started as a not-for-profit trust, which is called Deep Trust, which elicited this entire interest in the preventive program. So DEEP actually stands for Disease Eradication through Education and Prevention. And when we came to IIT K, we actually came with the trust. And when the concept got incubated, we had to actually start and incorporate a company during the COVID, while many were talking about losing jobs or talking of situations that were heartbreaking and gut-wrenching. We actually thought it was a grand success. In fact, it is always in the times of crisis that we find opportunities, and this was one for us. And with IITK, with Professor Amitabh, and then we also had Dr. Saravanan, who kept giving us valuable inputs about the chemicals that we had to use, because he was the right person to go to. And all the names that were suggested. We also had Mr. Shamendra Narayan, who was an ex-IITian, and he, I believe, he's the president of the alumni, and he came in, and the kind of collaboration and the kind of handshake that happened was phenomenal. And it was just a simple word of courtesy that the way ICICI, ITC, Hewlett Packard, all of them came forward with their CSR and all of it. It wouldn't have happened if not for this. And as you rightly put about it being as an opportunity for everyone, now we are booked with orders. And obviously, it is precisely what you mentioned about getting jobs, creating opportunities. And of course, the remaining sectors, as Professor Bandyopadhyay was talking about, the other things, I mean, it's just that I would say we're very lucky, and we thank everybody on the panel for having us here, actually. But otherwise, all the other ones, the PPE kits that Professor Bandyopadhyay was talking about, phenomenal work. And also talking about every other thing that you see here is a great opportunity for everyone.
And Sandeep, this innovation has happened earlier too. As some of the professors were saying earlier, it's happened earlier too. We're just talking about it currently right now because it's being seen once again right now in this current times. But do you believe that it should be talked about more? Like we said, it's always been there, this spirit of innovation, this culture of innovation. But when you talk about it more, that provides inspiration to others also, to innovate. When we have programs like this one that we are doing today, and we have campaigns like Go Vocal for Local and Atmanirbhar Bharat, it just spurs innovation that bit more. It's not that it wasn't around, say, yesterday or 5 years ago, but it just inspires others to also, become innovators too, doesn't it? You'll have to unmute yourself, Sandeep. Yeah.
Yes, of course. I mean, like it is not the one person centric innovation. It's like when it comes into the community, it inspires to many people. But I always believe on one, one this thing we call value of death. Okay, and the value of death is called in scientific community is called whatever innovations and ideas that is cultivate and happening in the lab that should be transferred to the commercial and industrial level. It should be scale up. And any idea which is getting died in the labs or maybe in the rooms, so that we call as a value of death. So today's scenario is basically, the value of death should not be there. Anything happening in the lab or maybe in the rooms or maybe anywhere else, that should be transferred. So it will only happen, the stories like you showing on the TV, okay, it will inspire many people, okay. So if someone has the idea or maybe they want to develop something and they are really not having the the infrastructure or maybe the platform, the infrastructure like IIT Kanpur and the incubation has, at least that will give them the kind of inspirations to come and start their ideas and the innovation, or maybe they can go further. And COVID is one of the pandemic, in today our entire world is suffering, but it is also an opportunity for us. It has given us a many dimensions.
That's a very valid point, Sandeep, because I've been saying that on my other shows as well that I do, that in every adversity you also have opportunity. You need to take advantage of that opportunity.
Absolutely.
Actually, I just wanted to add here that particularly the mechanical invasive ventilator project which Noka Robotics has done, which is a very high-end project.
Yeah.
And that has been really successfully commercially deployed and tested in the clinical setting. And it's a team of, I think, Harshit and Nikhil, the founders, they just graduated a couple of years back. They are very young, innovators. This should really serve as an inspiration to our crores of, young Indians that, if there is an opportunity, there is a talent, and they should be able to do it right here in our country.
No, the very, very valid point. Did you think, Harshit, when you were studying in the IIT Kanpur classrooms not too long ago, that you would be, you would have come up with such a project, that you would be an innovator today, who we are celebrating and talking about?
No, so this was not just in the college. I didn't even think about this 6 months from now, 6 months back from now.
Okay. So that's inspiration in itself for our viewers watching. But Dr. Karandikar, one point here, government talks about Atmanirbhar Bharat. You've responded to that call. So have your students, your alumni, and so are others in the country. But what do you also expect from government in return to help support you?
Yeah. So basically, we expect, an enabling environment. And, this is really the enabling environment where the government is saying that they will encourage, more and more indigenous products, to be deployed in the market. Even if you take today, ventilator project, IIT Kanpur, our ventilator is one of the top 3 ventilators, which, the government is sort of thinking of purchasing, and the other two are also the Indian companies. So we really need from the government an enabling environment where such innovators like Harshit and his team can really flourish, and that is number one. Number two, we really need, any high-end project like invasive ventilators or many other innovations require investment and funding. So we need an environment where such investments and funding can come in. Of course, I know that the government of India have many programs, and many such programs have funded our incubator. But if we really want to take this to the next level, then we need an environment where not only the government, but also the private investors, the venture capital investors, etc., can also come forward and invest in such projects, and the government should be able to support them. Then I'm sure there is no dearth of talent, so we really don't need to hunt or look for talents. That is all there in our great country. We need an enabling environment. We need an enabling environment, and I'm really very happy and proud that our government is moving in that direction already.
Okay.
And
Dr. Bandyopadhyay, since you are the individual who is, of course, in charge of incubation and innovation at IIT Kanpur, what do you say to your students and others who come to you for collaborative opportunities to inspire them? Let's hear it from the horse's mouth. What do you tell them? So our viewers can hear it too, who are not students of yours or who are not collaborative, collaborators essentially.
As a professor, you develop a quality of listening. You just become a very good listener. And I am very fortunate that I have a team which is very, very technically qualified, mostly IIT graduates. That is the incubator core team. We are very good listeners. So anybody comes with a idea, you have to understand that most of the ideas that come to our doorstep are half cooked. But it's very important to not to poo-poo them away, not to say it's really a bad idea. Just you have to engage them, and that's what we do. We engage them. We literally spend hours to talk to them, and eventually they will come up with an idea that is workable. But for that, you have to invest, a couple of months, and you have to be firm, but very encouraging at the same time. And that, I think, has been working at IIT Kanpur for a very long time. We have a very different kind of a DNA, and that is working.
Fantastic. Okay. Well, as we're running out of time now, let's end with just some messages that you would like to give to our viewers, of course, watching today. Let's begin with you again, Dr. Bandyopadhyay, and then we'll go around the panel. One message that you'd like to give people on the topic of innovation today.
Today, I am very happy and proud to say that look at these innovators. If they can do it, you can do it as well. If you need help, just come to IIT Kanpur. Our door is open for every Indian citizen.
Dr. Madhu.
Well, at the outset, I should thank the entire panel, Professor Bandyopadhyay, Professor Karandikar, Professor Ganesh, and my colleagues here. I'd say thank you so much, and I'll say Jai Hind.
Professor Ganesh.
Yeah, I think the necessity is the mother of invention, and that is something that we sort of have seen in the last 3 months. What happened? What are the challenges that we face? And if we can come up with appropriate solution, probably you'll be able to solve what challenges you face. And that's something that a real life experience for all of us, and this should stay with us. And every other challenge that you see, we should use this as an opportunity to come up with certain solutions that can help us in a big way.
Okay, Harshit.
Well, I would just say all the engineering projects which we do, all the studies that we do in while our engineering, we should stay engaged with real-time, real-world problems. If we try to solve real-world problems while engineering, it really helps a lot in the further days.
Yeah, absolutely. That's what I said earlier, taking the classroom to real life. Sandeep, Dr. Patil. Again, unmute yourself. I think one of our innovators should come up with an automatic unmute button. That's another
You
innovation.
should unmute immediately.
Okay.
Yeah, thank you. I must say thank you to NewsX for arranging this event. This is really path-breaking for the many people. And I must tell you, everyone here, we have been told every time that think out of the box. But I must tell everyone that there is no box. Okay, there is no limit for your thinking. Apart from that, this is the COVID-19 is opportunity. Just beg it and innovate new things for the new product. Thank you.
Okay. Well, Professor Karandikar, we began with you and we'll end with you. The IIT Kanpur director's closing message to, of course, the panelists and the viewers watching.
So I'm just saying that be passionate, stay focused, be patient, and I think sky will be the limit. And as this, panel, my esteemed colleagues have shown that we will be able to address any problem, any need that we as a society and we as a country need it.
Okay. Well, thank you very much. Continue innovating and continue to inspire us. All the very best to you. Take care, stay safe, and we wish you the very best. Thank you very much for joining us today on NewsX, all of you.
Thank you, NewsX.
Thank you.
To our viewers for watching as well. And let's hope to our viewers watching that you also take inspiration from some of the conversations you've heard today.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.